Thank you very much. Welcome to Labor and Health, first meeting of the session. Um, First thing I want to do before we do attendance or do anything is I just want to go over some rules of decorum, and have asked us just to read through these. And I'll be honest with you, I'm not going to read every word on the list because that will take half of our meeting. I would condense this to say, be nice, be polite, and play well with each other. Okay? That being said, this is just the rules that we follow. Our meetings are open to discussion of all viewpoints, and rules of decorum are in place to ensure that everyone can express their opinions free from abusive or distracting behavior. I would point out to you, and without reading through this, that it's important that the committee ask questions of those that are testifying, and those that are testifying give a clear, concise their thoughts and answer the questions that are asked. What I would ask of both the folks giving testimony and of the committee is that this isn't a time to debate. It's not a time for the committee to debate the people that are testifying, nor the people that are testifying to debate with the committee. It's simply a time to give testimony so we know what's going on, so we understand clearly what's going on. So I would ask civility, I would ask for a good decorum that way. The other thing that's awkward for people that have never testified in a committee previously is that all communications go through the chair. It seems awkward, but it's a way that we keep everything in order, keep it straight. So I would ask those that are testifying to please address the chair. You'll get it if you haven't done this before. Those who have done it before understand, but those who haven't will get it. It's an uncomfortable feeling, but it's important to go everything through the chair. And finally, I would ask all the speakers and the committee to avoid criticism. Number one, the committee of those who are giving testimony, we don't need to, it's hard enough to come up and testify. We don't need to be criticizing them. We can ask questions of them. Likewise, as the committee has seen in this committee and other committees, sometimes those that are testifying really want to say bad things maybe about the committee or about someone else in the legislature or about somebody else that's testifying. That's inappropriate. I think it's important that we maintain that civility, that we maintain that rule of decorum, and that we are kind to one another and give our opinions. We're not all going to agree. This morning, there's a good chance that everybody in this room will probably come close to agreeing, but in the committee, people don't always agree. And it's important that we can have discussions and disagree and do it in a way that it's a productive thing. So those things being said, I ask you to turn off any phones. We have a rule in this committee that if your cell phone rings in the committee time, and this includes committee members, then you will bring donuts to the next committee meeting. And we didn't get those. Whoever did that last year didn't bring donuts. So I know who it is too. I know who it is. He still owes us donuts, so we'll remind him. He'll be at the next meeting. Anyway, those are the rules. So please turn off your cell phones. Don't interrupt it. Let's have this clean and free of distractions, and let's have a good meeting and get some productive work done. If everybody can agree with that, we're going to do 3 bills in here this morning. It's a good way to start. We started out with bills that aren't real long. They're important bills, but it's important that we get through them. As the meetings progress through this session, even though it's short, the bills will get more complicated as we go. So let's begin with roll call, please.
Senator Barlow.
Present.
Senator Bouchard.
Here.
Senator Dockstader.
Here.
Senator Hutchings. Here. Chairman Baldwin.
Here.
All present, Mr. Chairman.
Okay, we have a quorum, we have a full house. Let's begin. The first bill we're going to hear this morning is Senate File 3, State Employees Leave for Volunteer Fire or Volunteer EMS. You'll notice that all these bills are really long this morning. This one is essentially a 2-pager. You'll recognize these all from the interim. Just a brief overview, and I'll just give a brief overview of this. This allows for volunteer fire and EMS, and you'll see that we do have a proposed amendment too, but we'll get to that when we get to the end. But this is to allow those who are state employees time away from work to respond to those emergencies, wherever that be. And I believe we have a number of hours that's on here. And you can correct me, I believe it was 12. Yeah. Okay, 24 hours. So that in essence is the bill, pretty straightforward. All these bills that we're hearing this morning are recruitment tools for the emergency services, for emergency workers, except for the one, of course, which is for the firefighters full-time paid on Plan B. And we'll get to that one. But these are recruitment tools. These are tools that don't spend money. These are tools that just provide a tool for our volunteers to get some new members. There's a shortage of volunteers across the board. And so with that being said about the bill, let's go ahead and just open up some testimony now. Do we have anybody from agencies? I don't see anybody. Oh, come on up. Welcome. Welcome to Labor and Health. I admire your barber.
Thank
Yes.
thank you, Mr. Chairman. My
Please
name is
introduce-
Alan Thompson. I'm the Executive Director of WASCOP, the Wyoming Association of Sheriffs and Chiefs of Police. And I provided a proposed amendment or suggested amendment on behalf of our sheriff membership in WASCOP, similar to the language that you might find in Senate File 008. We wanted to add search and rescue personnel to this proposed bill, allowing leave for firefighters, volunteer emergency medical technicians, and volunteer search and rescue persons. And I don't have anything else to add other than if you have any questions about the amendment.
Very good. Committee, any questions? We appreciate you coming down, by the way. Senator Bartle.
Thank you, Mr. Chairman. Thank you for being here, and congratulations on your new position. I don't think you were, did you testify in the last legislature? You did.
Not during the session,
Yeah.
Mr. Chairman, not during the session.
Yep, thank you. Well, welcome. So my question is, are generally just on the amendment, if you will, Mr. Chairman, volunteer search and rescue, they're actually generally run through the SO's office, sheriff's offices or something like that. Is that accurate? Thank
Yeah,
you,
Mr. Chairman, the statute says that they serve at the pleasure of the sheriff. So a lot of them are standalone nonprofits that when they are called upon by the sheriff are acting under the authority of the sheriff across the state. So it's,
Very good. Further questions, committee? Seeing none, you caught the committee at a good time. They're very quiet this morning. Thank you very much for coming.
thank you, Mr. Chairman.
Okay. Oh, you're not off the hook yet. Senator Hutchins.
Thank you, Mr. Chair.
Mike?
First time. Sir, the whole reason why we're here for the firefighters is because there's a shortage of firefighters. Where I came from, search and rescue and firefighters and EMT were all in the same bunch. They weren't with the sheriffs or with the police office. So what I'm wondering, do you see a shortage in search and rescue personnel as well? Because this is, in my view, an incentive for someone to join the fire department, not let's just open it up for everybody to get this time off, even though I understand the rationale behind it.
And Mr. Chairman, I don't have numbers of actual personnel in search and rescue units across the state. Some areas do better, some areas are short. In my experience in Sheridan County through my career, they had an authorized strength of around 40, and there's really only around 10 to 12 that were capable of responding to each of the calls for service that we had within the community. And it's my experience over my 25-year career in law enforcement that not only fire, EMS, but also search and rescue are suffering from the lack of volunteers in today's climate than they were 20 years ago or even 30 years ago. And I do believe that this is fair and equitable to all of those volunteer emergency services. I don't want to take anything away from fire and EMS. They're greatly needed in our communities. But I think we also need to give this opportunity to the volunteer search and rescue.
Thank you. Follow up?
Sir, you said you were from Sheridan?
That is correct, Mr. Chairman.
Sorry, Mr. Chair, we're sorry for your loss last night. Thank you.
Mr. Chairman, thank you.
Thank you. Senator Dockstader.
Just a note,
Bart,
Mr. Chairman.
Mike.
Just a note, Mr. Chairman, get back into the sync of things here. In these smaller rural areas, and I say this from a good senator from Cheyenne, a lot of these rural areas will team up. These the volunteer firefighters, emerging personnel, volunteer search and rescue, they work hand in hand on a lot of projects together. So it just seems logical to insert them in and include them with this amendment. Thank you.
And I would add to that, Senator Dockstader, and a lot of, including in our county, you'll find across the state, particularly in Western Wyoming, a lot of people that are volunteer firemen, are volunteer EMS, are also volunteer search and rescue. They work in another agency, they work in multiple agencies, and even with that, there's still a shortage. Anything to add to that, sir?
No, Mr. Chairman, thank you.
Okay, don't be shy. Okay, thank you. Okay, with that, come on up. Fire, guys. And even though you come as a group, you each have to introduce yourself.
Good morning, Mr. Chairman. Jared DeLay, Assistant State Forester, Fire Management Officer.
Good morning, Chairman. Christopher Fallbeck, Assistant Fire Management Officer for Forestry Division.
Very good. Go ahead, sir.
Mr. Chairman, how this bill impacts Wyoming State Forestry is this bill would allow state employees who also serve as volunteer firefighters and EMTs to reliably respond to when needed on private, state, and federal fires and other critical emergencies throughout Wyoming. Wyoming's volunteer fire districts are typically the first to respond and are integral in wildland fire response. Wildland fire response efforts by keeping wildfires small and containable during the initial response, thus keeping costs associated with suppression low. This bill would provide volunteer fire districts additional capacity during initial response, which can make all the difference when containment. A faster, more robust initial response makes a large, exponential, more expensive wildfire less likely. This bill could help reduce burdens on the emergency fire suppression accounts. Thank you.
Okay, let's go ahead and hear, you have something to add to that, sir?
Mr. Chairman, no, at this time, nothing else to add in that statement.
Very good. Okay, questions, committee? Senator Hutchins has one on her mind there. Nope, you're off the hook from Senator Hutchins. Anybody else have questions? Senator Barlow.
Thank you, Mr. Chairman, and thank you for the work you do with state forestry. And you've had two, I guess, good seasons listening to the state forester last night at the Forest Health meeting. But how many folks do you have in the field? Remind me, I know you're both or maybe Cheyenne-centric administrative in some way. That doesn't mean you don't respond to fires, but how many people are out in the field, or how many people that you might have that could participate in this type of thing? Just within your agency. I'm not talking about the whole state, just within your agency. Thank you, Mr. Chairman.
Mr. Chairman, Senator Barlow, I believe we have I would say there's about a total of 5 total within the division, which, as you know, we're a pretty small division anyway. So it's for number wise, it's probably a decent percentage wise just for the number of us. Thank you.
Further questions? Senator Hutchins.
Chair, it came back. Just quickly, right now, if there was a fire, these 5 guys or gals would rush out and try to help. Are they given leave now?
Mr. Chairman, Senator Hutchins, right now, if it was a wildfire and they were, I would say, during normal work hours at state forestry, we'd probably have them respond as state forestry personnel just for that wildland fire. But it could also help us in, if they're out in the field and there's a vehicle accident or some other need other than fire that would require volunteer firefighters and EMT personnel. Thank you.
Okay. Further questions, committee? Hearing none. Thank you very much. Okay. The fastest get the chairs first, so. Welcome to Labor and Health, sir. Introduce yourself and.
Good morning, Mr. Chairman, members of the committee. My name is Dirk Dykestal, and I'm with the Department of Health. Just coming here to propose amendment to avoid confusion. Just with the term emergency medical technicians, we specifically have a licensure level with that within the Office of EMS. We would just encourage a change to just emergency medical services personnel. Ooh. Just in order to avoid confusion. Otherwise, with that, I would stand for any questions.
Thank you. Questions, committee? Go ahead, Senator Barlow.
Thank you, Mr. Chairman. So I appreciate the distinction that we have a licensure, et cetera. So what does emergency medical services personnel encapsulate? And I guess what I'm thinking is this is EMT, paramedic? I mean, we're talking about a broader, I would assume we're talking about a broader group. What is that broader group? Thank you, Mr. Chairman.
Mr. Chairman, Senator Barlow, the change would, to include personnel would to be for all licensure levels that the Office of EMS provides, or at least in the state of Wyoming. Because your volunteer folks are more likely to be at the emergency medical responder level for their licensure. We have also about 5 different licensure levels. So it's really just any folks involved in EMS is what we would be encouraging that change for.
Follow-up, Senator Barlow.
Thank you, Mr. Chairman. So in this bill, the way it's currently proposed, and we have another amendment to add search and rescue, volunteer search and rescue person is actually means as defined, 39. So is there another reference that we should use that is more encapsulating than to your proposal? So what I guess I need to know is, I understand the words you're saying, but do we have a reference that we can utilize? Thank you, Mr. Chairman.
Mr. Chairman, Senator Barlow, no, there's not a different reference in specifically in 3336. It does refer to emergency medical technician. Unfortunately, there's just a licensure level at that same definition. So I understand the terms that you're using within the statutes provided. However, it does provide a little bit of an element of confusion. That's why we suggest that change.
Okay. He's going to the statute book. Okay, any other questions? Senator Hutchins has a question.
For me, when I'm thinking about someone working for the state, they're a volunteer, they fire some type of emergency, they get the alarm, they tell their boss they want to run out and take care of business. What's the chance of someone licensed at a higher level would work for the state and say, "Hey, you know, I have the authorization now to ask for leave." They're either going to be working with an ambulance service or with the hospital, not so much the state. Can you help me figure out what does it matter in this case?
You can address that if you want. I know we have some others in the
Yeah.
audience who will address that better. But go ahead if you want to take a stab at
Mr.
it.
Chairman, Senator Hutchins, yeah, we would approximate, and this is a tough statistic for us to really project just from the office's point of view. So our friends at the Wyoming EMS Association may have better statistics for this, but you know, we're approximating roughly around 30 to 35% of EMS professionals in the state that are responding are volunteer-based. To your question, I believe it was, what is the likelihood that someone with a higher licensure level is also a state employee that may require this leave? I couldn't speak to that necessarily in great numbers, but you know, I think what this also provides is just another mechanism for folks to encourage to be involved in the system and really try and enhance the service, or at least the personnel level in the state. I'll tell you, nationally, I think the statistic we've found most relevant comes from the National Fire Protection Association, and it's roughly about 30% of volunteers in all first responding agencies have decreased, or there's been a 30% decrease since about 1984. You can just see a decline in volunteerism in general. So I think that's what this bill speaks to.
Okay, keep that
Thank
question
you.
too. Remember that question because there's some other people that got
Thank you.
a good answer. Any further questions, committee?
Before we leave this, Mr.
Go ahead,
Chairman.
Senator Roxer.
I want to, these two Senator Barlow?
Yes, sir.
Have you found that? Because what we're seeing here, I got some confusion. We got medical technician in statute, and then to move it to service personnel. I'm not sure what this does, because I see a conflict coming. We get this sorted out before this gentleman leaves the bench here.
Go ahead, Senator Barlow.
Thank you, Mr. Chairman. So I think, so there's actually a reference to a definition, and then there's a second reference within that definition. So I'm trying to track those two down. So I don't know that we're going to get this resolved now, but if we pass this bill out, I will commit to resolving it before we come to the floor to get the definitions. And I guess when we get to that point in the conversation and we're working the bill, what I want this committee to let me know is if you want it to be expansive, as is being suggested by the Department of Health, or if you want it to limit it to really the licensure of an EMT. And I do think that we want to clarify that one way or the other.
Mr. Chairman,
With
that's-
that guidance, I'll go forward, but it's going to take me a little bit longer as a consultation to give you a
Thank you.
definitive answer now, Mr. Chairman.
And Mr. Chairman, I think we need to sort that out before we hit the floor, because we've got a proposal here that may move it out of statute, so we just got to make sure.
Yeah, and just off the top of my head, and some of the others can comment on this, but I know outside of the emergency medical technician, we also have emergency vehicle operators. We also have other people within that group that aren't necessarily EMTs, but they operate in the ambulance service, so we need to be inclusive. And we can get some more comment on that as we go through the other folks too, but yeah, certainly before the floor, we need to have an answer. So, any other questions for this gentleman? Okay, you're free for now, but don't run away. Okay, let's follow it up with some EMS people, if we could, please. Two gentlemen with also have good taste in barbers. Welcome, gentlemen. Go ahead and introduce yourselves. I think we know you. We've seen you a few times this year, but go ahead.
Thank you, Mr. Chairman. I'm Luke Seifert. I'm the president of the Wyoming EMS Association.
And I'm Eric Quinney, president of the Wyoming Fire Chiefs Association and treasurer of the Wyoming EMS Association.
Go ahead, gentlemen.
Thank you, Mr. Chairman. It should be no surprise that we support this bill, and we do see, actually, I think, a fairly strong recruiting opportunity with this. In fact, a couple of months ago in the Bighorn Basin, there was an incident where WYDOT personnel were the first on scene and indeed saved a man's life because of their response. Now, they were not trained personnel above layperson, like stop the bleed, et cetera, and CPR. But that incident and that event may then lead those personnel to say, I would like more training. That's what often happens is I wish I could do more. I wish I was more comfortable. And so that may be a recruiting tool just from an incident of a state employee who's not currently an EMT of any level, who then might say, I would like that training. And there's an engagement opportunity. So one of the most difficult parts of low call volume volunteer systems is the engagement, and that's for fire, EMS, and search and rescue. In Washakie County, search and rescue has suffered greatly. And then when there was an incident where we had significant need for search and rescue personnel, we saw greater engagement. And so what this bill really does is offer an opportunity for those who want to be engaged. In my service area, approximately 75% of 911 calls happen during daylight hours. And so you can see that there's a big need during the work hour to have the ability to respond. And again, that engagement is a critical part of recruitment and retention. I do have some answers to the questions, if I might, Mr. Chairman. So we do agree with the Department of Health in the need to use EMS instead of emergency medical technician, or emergency medical services instead of emergency medical technician. And as you mentioned, Mr. Chairman, there is a position called a driver, an ambulance driver. That's an actual position, but it's not a certification or licensure level. And so that would not be covered under the current definition that was referenced. Also, other personnel who may not be covered are nurses of various levels who, under a position statement between the Board of Nursing and the Department of Health, allow nurses to practice on the ambulance within an EMT level as provided by their medical director. However, they are not licensed as emergency medical technicians through the state of Wyoming. And so there are certain personnel who are left out of this benefit, this engagement opportunity and recruitment tool if we stick with emergency medical technician definition as written in the state statute. That's all I have, Mr. Chairman. It's time for questions.
Go ahead, Eric.
Thank you, Mr. Chairman. And also to follow up on the question from Senator Hutchins, I am the director of Uinta County Fire and Ambulance, and we run our ambulance service primarily on with volunteers. I have 51 volunteer EMTs and EMT intermediates and some driver positions. And I have, of those volunteers, I have several that work for the Wyoming State Hospital, several that work for WYDOT, and other state agencies. And one of the things that we require, or not require, is so vital to our organization, volunteer fire and EMS, is the employers allowing their employees to leave during work hours to respond to emergencies when there's not enough coverage. And by starting here with the state of Wyoming to allow this to happen is kind of for the state to set an example that we can then say and go to our counties and our cities and ask them to pass similar legislation and ordinances. And we already have employers out there, private employers, that are letting their people leave and paying them while they're gone to emergencies because they know the vitality of this. 65% of the nation's firefighters are volunteers. And of that, they save local municipalities and local $47 billion a year in labor time, volunteers do. And it carries across EMS as well. And so this is why this bill is so important, is because I have plenty of state employees that are volunteers for me on the fire and EMS side. And just the state setting the example to then that we can hopefully the counties and the cities and towns and private employers can follow suit to help us, because volunteerism is declining. And there's emergencies that happen, Monday through Friday, 9 to 5, that we sometimes are short on. And it becomes vital that that we have these volunteers to help. And so, yes, Senator Hutchins, plenty of state employees in my neck of the woods and all across the state that are volunteers, and their ability to leave and help when they can. Certainly a snowplow driver is not going to be able to leave during a snowstorm to come help, but there's plenty of times in the summertime when those snowplow drivers and WYDOT employees are not as engaged and busy, that when a wildfire starts that they can hop off the job for a few minutes and help. It's vital and important. Thank you.
Questions for Eric or Luke? Senator Barlow.
Thank you for your testimony. Thank you for the work you do. So going to the more expansive, or getting away from the EMT definition. So it's licensures, different licensures that we need to be encompassing of. Are there non-licensed? You talked about roles, meaning a driver, but I don't know if is a driver a licensure, or is it just a role within a medical service? So I want to be clear about how expansive we draw this. Seems like a driver is a different role. If they have medical training or responder training or something, that's one thing, but if anyway, so just clarify for that for me. And the other thing is, it seems like we have folks, paramedics would not be included in this either, the way I read it, because they are not EMTs. They have a different licensure. So just comment on those two things, please, Mr. Chairman.
Go ahead, Luke.
Mr. Chairman, Senator Barlow, that is correct. The driver is a role, not a licensure level, and so they would not be included in the current definition as it sits. So the state statute to transport a patient within rules and regulations requires that you have an emergency medical technician or higher and a driver. And so in volunteer services where they really struggle or where there are multiple calls, they utilize an EMT and a driver. You can have somebody who's, again, part of the service who doesn't have the licensure level who drives. And so they may have some medical training, but they're not licensed to provide care. But again, you can't drive an ambulance without a person, right? So you need somebody to drive and you need somebody to provide care. And that fills the gap. In fact, in my previous work as the director of the Washoe County Ambulance Service, we had 2 drivers who played a huge role in us being able to maintain our calls during, the dwindling years. And I can't imagine what it would have been like without them. And so those levels that aren't licensure levels, that are not included in the definition, are very, very important.
Go ahead, Mr. Quinney.
Mr. Chairman, Senator Barlow, just to follow up on that, I think it would make sense to kind of get away from the licensure language and just have it be somebody that's a volunteer with a fire department, an ambulance service, or a search and rescue agency, because people provide so many different roles We have people in our fire department that are firefighters and are actually engaged, and we have people that have been around for a long time that no longer want to put on that air pack and go into the fire, but are in a support personnel and come out and maybe are able to bring food or do things. So I think what the intent of this is to allow those that are volunteering with a fire department as a rostered member of a fire department or an ambulance service or search and rescue. I am favorable to that addition as well, and not define necessarily a licensure or a role. If they're volunteering and they're providing support to any emergency, I think this is what we want to have this bill encapsulate, that they're able to leave their job up to 24 hours in a year to help in that emergency, whether they're an EMT, a driver, or bringing out, critical food or water that may be needed to those that are actually maybe doing the firefighting itself. Thank you.
Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. So when I look at the bill and I look at the title, it says volunteer fire or volunteer EMS. So the EMS section that you're mentioning, sure, I think that it could be non-licensed people. But when it comes to search and rescue, that does not fit in this bill. It's not in the title. And so I mean, that sounds like a different bill to me. I mean, so when we're talking about search and rescue, that's not what this bill is. So, but anyway, as far as the volunteer EMS, that's what the title of the bill is. So I think we can be as expansive as we want within that realm. That's just my opinion. Thanks.
Okay, further comments, questions, committee? Thank you for your input. Yep, thank you very much. Stand by. Is there anyone else that wishes to comment on this bill? Seeing none, going once, going twice. Closed to public comment. Committee, does anyone want to move this bill? Senator Bouchard moved it, Senator Hutchins seconded. Okay, comments, discussion. Go ahead, Senator Dockstader.
Well, I want to come back to this question on the title, volunteer fire, volunteer EMS, and inserting search and rescue. So I question whether we can legally do that. I see the intent and I'd like to do that, but someone might offer some opinion if we can actually legally do that.
Senator Hutchins, comment?
Thank you, Mr. Chair. I think the gentleman from Uintah County hit the nail on the head. This is for volunteers. We want to kind of keep it simple, and it seems like we're trying to expand it here in this little session. We didn't hear from these people during the summer, so I think keeping it just the way it is, not trying to expand it to search and rescue, even though I understand their desire. Maybe sometime later on we can find a way to squeeze them in, but I'd like to just keep with what we're trying to do. Volunteers, fire, EMS, EMT, and get these guys the help they need when they need it.
And I would just offer a suggestion here, and committee can
Please.
take it or leave it. That is, I think the title does cover fire and EMS, and I think it's problematic to add search and rescue, and I think that's something that could perhaps come in the interim or as a personal bill, however we wanted to do that, to in future legislation, add to this statute and add volunteer search and rescue to it. But to add them at this time with that in the title, I think is probably would shoot us down. Secondly, I think being that the volunteer EMS is in the title, I think when you go to page 2, rather than say volunteer emergency medical technician, just to say volunteer emergency medical service providers. And I could be wrong, but I have a feeling that covers all of our drivers, all of our nurses, et cetera, because they're all emergency service providers. I don't know. There's comments on that. Senator Bouchard.
Mr. Chairman, could we just make a definition that goes in this bill that would encompass what that means?
That's one way to do it, and if you got the verbiage, we could certainly do that. Further comments, committee, suggestions? Senator Barlow's got something on his mind.
Thank you, Mr. Chairman. So I am not as concerned about adding I'll just start with this. I'm not as concerned about adding search and rescue folks, because a lot of them are probably going to have an EMS. If we expand the EMS, and a lot of them are going to have a first responder or EMT or some kind of training. So they'll probably fit into it, many of them anyway. So I think that's something that maybe we don't need them in there, but I don't think adding it to me is not going to be that problematic personally. I think the intent of the bill is what I'm looking at, not maybe the the black and white. I am intrigued by and I think maybe the term has been used, expansion. I think I am intrigued by both, like adding search and rescue, but also making sure we're not fencing certain entities out by including all the definitions. So now that I've looked at the voluntary emergency medical technician definition, I'm going to have to go back and look at the volunteer firefighter definition to make sure we're not actually fencing folks out with that use of that definition. So maybe actually what we should, anyway, so I throw out that I'm going to move this bill forward. I'm going to actually, speak in favor and vote in favor of the amendment and move the amendment on the search and rescue. But I'm going to make a commitment to this committee and to those interested that I'm going to try to come up with a way that we're more inclusive of the roles that may be necessary in a volunteer setting. So thank you, Mr. Chairman.
Senator Dockstader.
A little more from Senator Barlow. How do you do that? How do you do the search and rescue when it's not in the actual title? I'll do that. And then I want to see the bill move forward too, but we're trying to move from what's in statute, from technician to personnel to providers. How do we, Mr. Chairman, how do we want to move this out? With which wording, which verbiage do we want to use? At least at this point, so we have less problems on the floor with trying to define things. How can we move this out and have it taken care of as early as possible?
Senator Bouchard.
Mr. Chairman, can we lay this back and just try to come up with the better ideas and do it in the next committee meeting? Because once we get there, it'll only take a few minutes, I would think.
We can. I will tell you that on a limited time schedule, we may run into a problem, but that's one of the things we could offer. We don't know what all this committee is going to hear yet. We may hear a lot of bills. We don't know for sure what's all coming at us, but that's certainly one possibility. I guess the other possibility is we could move this bill forward, perhaps make a couple alterations, and then as Senator Barlow suggested that he was wanting to work on language, I would suggest getting together with some of the folks in the room and putting together some verbiage that would work better for on the floor. But
Mr. Chairman, if we could please, if we could counsel a little bit with our legal staff as well.
correct.
Possibly, I'd say let's move it out of here. But if there's something that needs to be changed on the floor, I'd like to get it right the first time. I'd like to hear from Senator Barlow on how he feels about inserting search and rescue. I'm all for it, but I don't see legally how we could do it under this title.
Senator Barlow.
Thank you, Mr. Chairman. So what I'm going to suggest is, if this committee is so willing, we'll do a conceptual amendment that will be prepared as a committee amendment to just deal with the emergency medical technician and the volunteer firefighter issue. So, and then I will bring a personal amendment to add the search and rescue, and we'll have that discussion on the floor about whether we want to add this within the title or challenge the title, the limitations of the title. So it won't be the actions of this committee. It'll be something I'll bring to the floor, and we'll take it that way.
No, Mr. Chairman,
Go ahead.
I think we can add it now in the committee. If someone wants to get uncomfortable on the floor, we do it that way.
Mr. Chairman,
Go ahead.
I think what my good colleague, Chairman of Minerals Committee said is, let's all add it all in now. I'll be glad to carry the bill and take that and try to visit with the body about how they want to proceed. If this
I like
bill
getting
moves forward.
volunteers before we even approve the bill. That doesn't happen often in
Well,
this
we're
committee.
talking about volunteers.
Yeah. Okay, committee. So we have the bill moved and seconded. Further discussion. Amendments.
Mr. Chairman, so I would respectfully say that we add the amendment for the search and rescue persons, understanding that there is some language, there is a definition on the first page refers to 35.9. There's a blank there, so we're going to have to come up with a definition. Also understanding we may be removing all statutory references and going to a broader just broader use of the language instead of being restrictive, so. And I can bring those as personal amendments.
Okay, second on the amendment?
Second.
Second by Senator Dockstader. Discussion on the amendment? No discussion? Let's vote. All in favor of that amendment, say aye.
Aye.
Opposed? No? Okay, that amendment passes. Okay, any further amendments, committee?
Mr. Chairman,
Go ahead, Senator Dockstader.
I would amend that we include search and rescue now. Let's get it moving forward.
Where precisely would you like to put that, Senator Dockstader?
Where he just crossed it out, I'm gonna put it back.
I just moved that. Was that included? I thought you were
Broadening the medical technician.
No, this way, he added this amendment.
Okay, all right, we're fair.
Okay. Okay, further amendments, committee. Further discussion, Senator Barlow.
Thank you, Mr. Chairman. So I do think we need to deal with all of them, all the references, the statutory references for the EMT, et cetera. But I'm not prepared to know what that proper language is, so I'll bring that as a committee of the whole amendment and try to clean that up for the committee. That's acceptable to the committee.
Okay. Committee in agreement with that? Further comments before we vote? Let's take a vote.
This is a roll call vote on Senate File 3 as amended. Senator Barlow?
Aye.
Senator Bouchard? Senator Dockstader?
Aye.
Senator Hutchings? Chairman Baldwin?
Aye.
Mr. Chairman, we have 3 aye and 2 no.
Okay, that bill will proceed. The volunteer, Senator Barlow, will manage that on the floor. Okay, committee. That brings us to Senate File 4, rehiring retired firefighters, continued retirement benefits. Do we have any state agencies, Department of Health, anybody else wish to comment on this? Welcome. It's your first time in the chair today. Committee, first note before we dive into this is that just work through the bill real quick. We'll present the bill. This is very similar to a bill we did last year for law enforcement. What this bill does, plain and forward, is firefighters under Plan B, paid professional firefighters who have retired. This would allow them to then come back to work without being penalized by losing their retirement benefits. And that's essentially what it would do. That's the gist of the bill. Senator Hutchings?
Thank you, Mr. Chair. Just a quick note. I don't know if the audience understood possibly our no votes. When we have a title to a bill, each bill constitutionally has to address that title. And when we make changes, we have to have a constitution. We just can't do it. So my no vote was just challenging the constitutional issue. I want the bill to pass the way it was. So that's just my comment, so you guys know that one title per bill. Thank you.
Thank you, Senator Hutchings. Okay, now you've warmed the seat up. Go ahead, introduce yourself and go ahead and talk to us.
Mr. Chairman, members of the committee, welcome to Day 3. Happy Valentine's Day. I'm David Swindell. I'm the Executive Director of the Wyoming Retirement System, and we're discussing Senate File 004, rehiring retired firefighters and continuing their retirement benefits. Mr. Chairman, members of the committee, the bottom line is WRS, this is actuarially neutral to the plan. WRS can support this bill and we concur with it. The rest is all color. I don't want to take a whole lot of time. We have switched gears a little bit. We were talking primarily volunteers on the first bill. Now we're talking paid firefighters. These firefighters are in our paid B plan. That plan has 388 active members. There's 172 retirees. We've got 17 other beneficiaries. The cities of Cheyenne and Casper are the largest employers. I believe Cheyenne has 90 sworn in the system. By way of reference, this plan is well funded. It's 97% funded in pension lingo language. We've got 211 million assets in this fund. We paid $7.8 million in benefits last year. The normal situation in a public pension plan These are all tax advantage plans under Department of Treasury and IRS regulations. We earned 13.6% on our investments just this last calendar year, just FYI. We're not going to pay any income tax on that. Employers are allowed and employees are allowed to make contributions to the plan pre-tax. So these are all tax advantages that are authorized by the federal government because it's a public pension and it serves a public pension purpose. Congress and via the IRS took a dim view of people retiring from a plan and then going back to work within that same plan. The idea was these public benefits and the tax advantaged nature of it is for retirement. It is not for someone to draw retirement and go back to work within the same plan. And so that was generally prohibited. And the solution was, and the standard remedy still is, the person needs to cease their retirement benefit, go back to work, earn maybe additional service credit, and then when they really retire, we recalculate their benefit and the benefit starts. That's the standard method. There are some issues with that because sometimes employers are having critical needs trying to bring back people and fill critical positions. And although we're in favor, sometimes criticizing the federal government, the Congress and the IRS have heard those pleas. And they've made authorizations for plan sponsors like the state of Wyoming to adopt rehired retiree rules within certain guidelines that allows a person to go back to work, continue their retirement benefit. They don't earn any additional service credit, and the employer pays the full contribution that would otherwise be needed for a new employee. And that can go on, and that's kosher with the IRS as long as we adopt the rules according to IRS guidelines. Those rules already exist. We have a rehired retiree provision in the Wyoming Retirement Act that affects the public employee plan, the law enforcement plan, the Air Guard firefighter plan. And Mr. Chairman, as you mentioned, we added that reference to the Warden and Patrol plan last year. And this bill simply adds that to Fire B and gives Fire B employers the option to exercise that if they feel they need to. My personal view is this won't be used a whole lot. I think most fire situations, once you've been a professional firefighter, that was then, this is now, I'm not going to go back. There's not a lot of that. And I think also most professional fire departments have a succession plan. There are people ready to step up to be captain or to be the assistant chief. But there can be local situations where that's not the case. And as I think we discussed in our interim hearings, although it may be rare that this is used, in cases where it is used, it's pretty darn important to that entity. And so there's no reason not to offer this to our local employers, and that's what this bill does. Mr. Chairman, that concludes my testimony, subject to questions from you or the rest of the committee.
Questions, committee? That was a good explanation. I appreciate it. Senator Barlow?
Thank you, Mr. Chairman. So thank you for being here. Thanks for the work you're doing. And those are pretty dang good returns. I might have to, anyway, we won't go any further there. We've got a bill on the floor right now that had something to do with that. So there might be a little bit of fresh blood in the water. My question is, what other pensions do you have that are not included in the list that you gave us? So this would be an addition. Are there others that are out there that are not included in this rehire policy statutorily? Thank you, Mr. Chairman.
And Mr. Chairman, Senator Barlow, there are 3 other plans that would not have this. 2 of them really don't apply. We have the closed Fire A plan. There's no active employees in it, and they're all getting pretty old at this point. So we haven't added that to Fire A. And then we have the volunteer firefighters, EMT, and search and rescue pension plan. These aren't paid people anyway, so there's no issue of bringing back a rehired retiree and continuing their benefit because there's no payment. They're volunteers. The one plan that does have active paid employees in it that's not affected is the judicial plan. But there hasn't been any real need to bring back retired judges. Usually they serve out until the end of their term and they're constitutionally limited by age and they can't come back for other reasons. And so that judicial plan would be the only plan we wouldn't have that doesn't have a retired rehired retiree rule.
Mr. Chairman?
Senator
One more
Dockstader.
clarification on this. We're bringing people back into the system with their full retirement benefits and saying you can also receive a paycheck to work. So where else, I'm not clear, where else are we doing this?
Mr. Chairman, Senator Dockstader, this provision is available in the public employee plan, which covers all our teachers, all of our city and county general employees, and most general state employees, including folks like myself. We have that available in the law enforcement plan, which covers state correction officers, dispatchers, and then the majority of that plan is city police officers and county deputy sheriffs. We have that available in the Air Guard firefighter plan, which is a small firefighter plan for the military department. All state employees, I think there's 55 people in that. And we have that available via legislation adopted last year in the Warden Patrol and DCI plan that impacts our state troopers, sworn game and fish wardens, and our investigators in the AG's office.
Thank you.
Further questions, committee? Seeing none, thank you very much. Mr. Reddy, I see you're ready. You've heard that joke before, haven't you? Okay. Welcome to Labor and Health. Go ahead, sir.
Thank you, Mr. Chairman. My name is Kevin Reddy. I'm the president of the Federated Firefighters of Wyoming, and I represent the majority of the career firefighters in the state. To answer your question, Mr. Chairman, yes, I have heard that joke before. We are in full.
That's all I tell is bad jokes, Kevin, by the way. Go ahead, sir.
We support Senate File 4. We see this as a potential retention issue, which may solve some of the recruitment and retention problems across the state. So with that, that's all I had.
I would have a question for you. Well, tell us about that, just briefly about the retention problem, about the recruitment problem within the, and we've talked about the volunteers and volunteerism. Tell us about the pay, the professional firefighters. What kind of a problem do we have in that system?
Mr. Chairman, luckily for us, we're not in dire straits as far as recruitment. And listening to the volunteers, it sounds like it's almost at crisis mode, but we are seeing a trend downward nationwide. I work here in Cheyenne as a lieutenant with the Cheyenne firefighters, and when I tested in 1999 to get on the list, I tested with 400 applicants. Right now, we're lucky to get 50 applicants for the same 2-year list. Those lists are still getting filled. We're just not seeing the massive draw to the fire service. And like I said, this is nationwide. I don't really have any data as to reasons why people don't want to serve in the fire service, but we are seeing a downward trend in recruitment. So the other option is to try to retain our senior members as they approach retirement. Currently in the state of Wyoming, once you reach your full 25 years of service on the Plan B pension and reach age 50, there's no economic incentive to stay in the fire service. So many of our members just retire and go on to other careers. This may provide an option where we have very experienced, trained professionals that could be available to be rehired by the Wyoming Fire Services.
Questions from Mr. Reddy, committee? I would point out that fire service, among other services, EMS, is some of those things you can't do from home. So none of your employees are at risk for working from home. Okay, well, volunteers do, I guess, but that's different. Okay, further questions from Mr. Reddy? Thank you very much. Anyone else in the room wish to testify to this bill? Going once, gone. Committee, somebody want to move? Moved by Senator Barlow, seconded by Senator Hutchins. Discussion, amendments, committee. We're ready for the question.
This is a roll call vote on Senate File 4. Senator Barlow. Aye. Senator Bouchard. Aye. Senator Dockstader. Aye. Senator Hutchins. Aye. Chairman Baldwin.
Aye.
Mr. Chairman, we have 5 aye.
That bill passes committee. Do we have a volunteer to floor manage that? Senator Hutchins said she'd love to. Okay, your best. You'll do great. Okay, committee, that brings us to our final bill for the day. Senate File 8, Health Insurance for Volunteer Emergency Responders. Okay. Who would like to walk us through this bill? Me? I'll volunteer. Okay, this bill, and you're all very familiar with this. We talked about this during the interim. What this bill is a tool for recruitment for the volunteer fire services or for volunteer emergency responders in that, and I'm just looking at my front page here, I see the volunteer emergency medical technician definition again. Anyway, that being said, what this is a method of recruitment so that we make available to these emergency responders the state insurance program. Now, the important thing as we go through the bill, what this does is just make available to them the state insurance program where those volunteers can apply to be a part of that. On page 2, you'll notice that there's requirements. They don't just apply and say, yeah, you're in. And I know this was brought to us by a constituent, actually, in Senator Dockstar's area of mine. What kind of requirements on it? We don't want people coming in and just using this benefit and then walking away. There are requirements if you look on page 2. And if you read through this is exactly the same requirements that these volunteers have to meet for the Wyoming Pension Program. They have to be there 90 days. They have to have, now I'm reading through, but attendance requirements nonetheless, the same as they do for the volunteer retirement program. The other important thing to read through here is that the state of Wyoming pays nothing into this. This is entirely a cost borne by the volunteer. And that's an important thing to separate out. I know there's been some miscommunication and some misunderstandings about this, but this is something that the volunteer would pay on their own. Also noted on page 3 is that 1 year, there's the requirements on line 9, talking about the 50% of the monthly volunteer meetings and the calls, 25% of the calls for service to remain eligible for the service, and then they have to renew this every year. It just doesn't stay in effect, go on and on. Page 4. There again, it just talks about this is something that already happens through the retirement program, talking about submitting reports. And I'm sure you'll hear from some of the volunteers that come up about how those reports are already filed. That's not something new. Moving to page 5, there it talks about who's going to pay for it. It's paid for by the volunteer themselves. And so on and so on. It just adds these folks into the state insurance program as the bottom line of the bill. And it makes available to them. And the recruitment tool would be important for things like farmers and ranchers that right now don't have insurance, that can't afford to go on some other insurance. This would make available to them an option, make it available and a recruitment tool to maybe say, hey, I can become a volunteer firefighter if this is something that's available to me and my family. So that being said, we'll go further into any of the verbiage if you want when we get down to working the bill, but that's the gist of the bill. Just making this insurance available to these volunteers as a recruitment tool. That being said, do we have any state departments, Department of Health?
Good morning again, Mr. Chairman, members of the committee. Dirk Dykestal, Wyoming Department of Health, Public Health Division. Again, we would just propose a similar amendment to the previous bill that was proposed, changing to include more emergency medical personnel into this. Again, just the terminology, it leads to some confusion or has the potential for leading to some confusion. So again, with that similar proposition, I would stand for any questions.
Questions, committee? Go ahead, Senator Dockstader.
Dirk, you got us off on a big discussion before with this. Since we're still a little unresolved, so I'm trying to decide how we best want to do this. Go ahead.
Senator Barlow.
Thank you, Mr. Chairman. So you will note in this bill, when they refer to these different services, some of them, they're not referring to a statutory reference. EMS they are, which actually I can't find in my statute book. There is no 220, at least in this book, so I'm going to have to correct that no matter what. Oh, are we creating it in the beginning or in the end? Okay, my apologies.
Oh, you're right there on the first page.
First page, my apologies.
Line 10.
So maybe we need this definition to go into the other bill, and that might solve a lot. So anyway, I'll have to look at that. So anyway, no, I don't have anything else, but I do appreciate the comment. And thank you for my colleague for pointing out that I wasn't reading the bill.
Thank you very much. Further questions for the presenter? Thank you very much. And we don't have anybody from A&I here, is that correct? Seeing no one. Okay, thank you very much. Any other state departments or agencies? Welcome back, gentlemen. Reintroduce yourselves and speak on a new topic.
Mr. Chairman, Christopher Fallbeck, Assistant Fire Management Officer for the Office of State Lands and Investment Forestry Division.
Jared DeLay, Assistant State Forester, Fire Management Officer for the Wyoming State Forestry Division.
Go ahead.
Mr. Chairman, we have no objections to this bill. This bill will help support the wildland fire suppression community, recruit and maintain qualified volunteer firefighters who are needed to respond to private, state, and federal wildfires throughout Wyoming, making them ultimately more effective. Wyoming's volunteer fire districts and departments are typically the first to respond to and are integral to the wildland fire response effort by keeping wildland fires small and containable during initial response, thus keeping the costs associated with suppression low. This bill will provide volunteer fire districts and departments additional capacity during initial response, which can make all the difference in containment. A faster, more robust initial response makes large, exponentially more expensive wildfires less likely. This bill could help reduce the burden to our emergency fire suppression account. And the only other thing to add to this is that this bill does not impact state forestry's budget or operations, as this bill supports volunteer fire departments.
Very good. More comments? Go ahead.
Nothing more. Thank you.
You've gotten away with that twice now. Questions for these gentlemen committee? Seeing none. Thank you very much. I see that we have a representative in the room. Representative, welcome. Welcome to the brighter side. Go ahead, sir.
Thank you, Chairman, and good friends down the hallway. Andrew Byron, representing House District 22, but also today with a hat on from Hoback Station 3, which is South Teton County. I think it's worth noting that I talked about South Teton County, but I have a colleague in the room and we respond over county lines into Sublette County and also into Lincoln County. I'm about 10 years into the fire service now. I'm ranked lieutenant at Hoback Station 3. When I joined, we had 12 members at Hoback. Today, with me down here, there's currently 4 at Hoback. So we have 4 apparatus. So if we hear the tones go off, we'll be lucky to get every apparatus out the door. More likely, we'll have 4 people on an engine and be leaving resources behind. So we are in a dire situation with volunteer recruitment and retention. And I really stand in support of this bill. I think it would be a great tool for us. You know, we've done some straw polls amongst, pretty easy to do a straw poll, and there's only 5 or 6 firefighters, but in our station alone, it could certainly affect half of them. And I think that's really important to note, because if you look back on a quieter year, my colleagues that just spoke, very lucky to have a quiet wildfire year. Without that, I had about 10 days of volunteer time. I don't want to break into hours, 10 days away from my family, 10 days away from my work, responding to calls all over Teton County, Lincoln, and some over the boundary into Sublette. When I fought the Roosevelt fire, it was over 20 days of time away from family and work and my community. So I think that this is a wonderful opportunity for both bodies and hopefully our state to not give a nod to the volunteer efforts and the time that we spend protecting our state and protecting life and protecting property. So with that, I stand for question.
Thank you for your service, Representative, both representative and a firefighter. Senator Dockstader.
Thank you, Representative. You started 12 down to 4. How would you take this and just get the word out? You're just going to go face to face and say, we have a better picture now for you to come to work at. Is that how you're going to do that? That's a scary number, 4. It's almost like, I think about south towards Cokeville. We got what we call black holes of help. There's not enough people to go help, and coming up through the Hoback and Snake River Canyon, same situation.
Go ahead,
Yeah.
Representative.
Thank you, Chairman. Thank you, Senator Dockstader. And there are black holes all over our state. in everyone's communities. And I think this is a great tool because we will be able to talk to our neighbors, we speak a lot how volunteering generally is down. This is happening nationwide, and we can use this as a tool to recruit these firefighters, the men and women. There's been some mention of quantitative data of where, do you make X amount of calls? Do you make X amount of trainings? I will say for our membership in Hoback, we ran about 70 calls last year. All of our members made at least 50% of them. And because we are lucky and we have dinner at most of our trainings, our training attendance is well over 90%. So I think that when someone's signing up to do this and going through over 600 hours a decade ago to become all hazards for myself and my colleagues, I think people know what they're getting into. And I think that's a tool, Senator, that we could certainly use and say, hey, you're working your hiney off, you're doing a lot for your community, and then, when you go home and the pager goes off, you're going to your second job. So I think it's a great opportunity to try to build that number from 4, maybe up to 6, 7, 8, just so we can begin to try to close those gaps and make those black holes gray holes.
Thank you. Further questions, committee? Thank you for coming across. We appreciate your presence here. Happy Valentine's Day, Representative. Okay, further public comments? The two guys with good barbers who I would add, these are my neighboring fire departments, one on each side. So I have to be nice to them. You guys do whatever. But gentlemen, introduce yourselves.
Good morning. My name is Shad Cooper. I'm the fire chief and county fire warden for Sublette County Unified Fire. I also have the pleasure to serve as the president of the Fire Advisory Board, which is the executive board of the Wyoming Rural Fire Association.
Mr. Quinney.
And I'm Eric Quinney, Chief Administrative Officer for Uintah County Fire and Ambulance, and also President of the Wyoming Fire Chiefs Association.
Very good. Go ahead.
Thank you. Thank you for your time, Mr. Chairman, members of the committee. We very much appreciate being in front of you today. It's great to see you again. It's been a long year to get to this point. I'm super happy to be here and be able to present this to you. As we've discussed in the past, when this bill came out of committee with unanimous support, this is critical to the Wyoming Fire Service. We've mentioned in the past the need to recruit and retain our volunteer firefighters. We have some statistics for the Wyoming Fire Service. There's approximately 141 fire departments in the state of Wyoming, a total of 3,637 firefighters, 88.6% of which are volunteers. Statewide, we responded to about 43,855 incidents, and the majority of which are actually made up of EMS incidents. But then when you break that down, looking at emergency vehicle wrecks and structure fires and wildland fires, we actually have some statistics on how many wildland fires and where they occur in which counties. So there's quite a bit of statistical information here that kind of goes to the need. Last year, when we asked for the interim committee topic, we sent out a survey statewide to the fire departments in the state. We received about a 50% response rate to that survey. The statistics that came out of that survey were alarming. Approximately 88.8% of the respondents to that survey indicated they're currently experiencing challenges recruiting volunteer firefighters, or new firefighters, I shouldn't say just volunteers. 92.5% of the fire departments believed a statewide recruitment and retention program would assist them with the challenge they're facing. On average, on average, the respondents indicated that they were 29% below staffing levels. So we asked them, if you were at maximum staffing levels, what would that number be, and how much, are you short of that? And the average came back 29%. There were fire departments that were in 60, 70, even one of them that indicated 90% short on volunteer firefighters. And in total, the respondents indicated that there were 468 firefighters short across the state of Wyoming. So that's the reason why we came to the interim topic, and with your work over the last year, we're able to produce this bill. We're very happy with the bill. I think it goes directly to the heart of what we're trying to achieve, which is to recruit and very importantly, to retain firefighters within our service. This bill gives incentives to do both. It gets directly to the heart of what we're trying to accomplish. There's some important parts of the bill. As the chairman mentioned during the introduction, there are minimum requirements. There is a clause in there that there was some concern about, somebody joining the fire department, so and then immediately being available to have access to healthcare. So now there's a 90-day waiting period before you're eligible to enroll in the program. There's also requirements, as you mentioned, 50% response or attendance at trainings and 25% attendance at emergency calls. There's an important consideration that they must not be eligible for health insurance coverage under a government-sponsored healthcare program, so they can't already have availability to have insurance somewhere else. And there's also a requirement that they shall not benefit from employers' contributions. The bill goes on and says that the state of Wyoming is not going to provide for this benefit, so there's no cost to the state of Wyoming. The cost for this health insurance comes directly on the shoulders of the volunteers. They're responsible for paying for the cost to access this healthcare benefit. So the reason why this is important is because what this does is it allows the volunteer firefighters and EMTs and search and rescue members to join a larger group, a pool of other insured members, which as a collective lowers the cost for those people that are in that pool. So this is a benefit to the emergency responders in the state of Wyoming, and as I mentioned, it really will impact the recruitment and retention of specifically, I'm here speaking for volunteer firefighters today. I have volunteer firefighters in my own organization that call me on a regular basis, asking how this bill is advancing. Are we near the end? Is there a light at the end of the tunnel? When can we look forward to receiving benefits or having access to this healthcare benefit program?
Questions? Go ahead, Senator Hutchins.
Thank you, Mr. Chair. Thank you for that presentation. This is really nice. Who put this together?
Go ahead, Chad.
Mr. Chairman, that was a collective effort between the Wyoming Rural Firefighters Association, the Wyoming Fire Chiefs Association, and the Wyoming Firefighters Association.
Go ahead, Senator Hutchins.
A good recruitment tool. Yeah, very nice, very inexpensive. Just a quick question on the last statement you made. People were getting excited. When's this going to start? Is this going to be kind of retroactive or what? Will firefighters that are already in come in and say, okay, I've been here, I've done my 90 days, or will you start once this bill goes into effect with the 90 days? Being at 50% of your training sessions, responding to the fires? How's that going to work out?
Chief Cooper, go ahead.
Mr. Chairman, the bill calls out that after initially volunteering for 90 days, once the 90-day period is over, the volunteer shall have 31 days to enroll in the group healthcare plan. And it further goes on that there will be an enrollment period once per year afterwards that they have eligibility to participate in that. And I believe there's an effective date on this. I believe it's the beginning of the fiscal year. I don't want to misspeak that, though.
Mr. Chair, I'm wondering about the firefighters now. Or are you going to use this for volunteers in the future? How's that going to work? That's what I'm asking.
Go ahead, Chief.
Mr. Chairman, Senator Hutchins. Yes, the volunteers that are currently on our roster now would be eligible once this bill takes effect. And it says there in Section 4, except as otherwise provided, subsection of this section, the act is effective July 1st, 2024. That would be when they'd be eligible for that enrollment period, assuming that they've met the other requirements.
Okay, thank you.
Okay, further questions? See none right now. Go ahead, Mr. Quinney.
Thank you, Mr. Chairman. And just to elaborate on what Chief Cooper said, one of the neatest parts about this being a recruitment tool is the people that are going to be best served by this are people that are ranchers, self-employed people that don't have insurance through other employment, that make perfect volunteers because of their flexibility in what they're doing on their full-time jobs in terms of ranching or being self-employed. And they make perfect candidates to be volunteers because they have flexibility in their schedules. And so these people are people that we want to go out and target and bring to the fire service because they can leave at the drop of a hat more easily than maybe somebody that is going to a a 9-to-5 job or works at the Trona mine and is underground and cannot leave work to respond to an emergency. So these people that are going to best benefit by this piece of legislation make perfect volunteers. And I think it's going to be such a great recruitment tool to be able to do that. And again, emphasize, I know there's a lot of misinformation being put out there that this is increasing state spending, that we're not being responsible with the state's money. This bill has no impact to the state's budget. These volunteers are still going to be paying quite a bit of money to receive health insurance, but it's going to be cheaper than that they're able to find out maybe on the marketplace or wherever they might be able to get private insurance. So $0 cost to the state, but a huge benefit to the volunteer service in the state. Thank you, Mr. Chairman.
Senator Dockstader.
Thank you, gentlemen. Do you see anything that would prevent a district from paying for the insurance on behalf of their firefighter or their emergency responder?
Mr. Chairman, Senator Dockstader, this bill prohibits that. This bill has language that prohibits the fire district from paying for insurance on behalf of the
So it
volunteer.
all comes just strictly down to the person paying for it.
Correct.
Thank you, Mr. Chairman.
Further questions, committee? Seeing none. Thank you very much, gentlemen. We appreciate your service. I especially appreciate your service. Oh, you're not off the hook. Senator Barlow.
Thank you, Mr. Chairman. So I want to go to we've talked a little bit about this EMT definition issue. And actually, as I look at the definition more, I'm getting more comfortable with it. But if you have any suggestions, please forward them to me, and I'm going to visit with the Department of Health as well. But the same with the volunteer fire department. I think actually what it comes down to is whether they're on the rolls or not. It comes down, and I see that language in both the volunteer fire department and I see it in the ambulance service. So I think it comes down to whether you're on the rolls or not. And we've got a fire service person here and medical service person here. So that is probably what the defining characteristic is. And I think the same language under search and rescue as well, county organizations. So anyway, I'm getting more comfortable with where we are. But anyway, if you have any suggestions or thoughts on that, please shoot them my way. Thank you. Thank you, Mr. Chairman.
Mr. Quinney?
Mr. Chairman, Senator Barlow, I think you're exactly right. If we can narrow that down to rostered personnel of a fire department, a volunteer fire department, an ambulance service, and then search and rescue, same thing. Rostered personnel, I think that encompasses everybody. Rostered personnel. It doesn't matter what license or certification they have. If they're on the roster, they are volunteering for that agency. I think that's what we want to zero in on, and we'll work on that with you. Thank you.
Thank you. I feel comfortable that you all are getting more comfortable. Okay, thank you very much for your service. Thank you especially for your service. Come and visit Lincoln County anytime you want. Thank you, gentlemen. Further comments? Public comment? Welcome back.
Thank you, Mr. Chairman. My name is Luke Seifert. I am the president of the Wyoming EMS Association, and I just want to express our support for this bill. We also agree with the definition that Chief Quinney put forth.
Very good. Questions, committee? Seeing none, this almost feels like a kumbaya moment here. Thank you very much.
Thank you.
Anyone else wish to comment on the bill? Now's your chance.
Mr. Chairman, we do have one person online.
We do. Let's admit them in. And if it feels like everybody in the room is looking at you, they are. This would be Robin.
Yes, I'm promoting Robin Momsen. Robin just needs to turn on their video and audio.
There we go.
There's Robin. Robin, we can see you. We can hear you. Go ahead, ma'am. Welcome to committee. Introduce yourself, please.
Happy Valentine's Day. Thank you, Chairman Baldwin and Senate committee members for giving me the opportunity to speak today. My name is Robin Momsen. This is my husband, Chris Momsen, a 21-year volunteer firefighter with Jackson Hole Fire EMS and captain of Station 2 in Wilson, Wyoming. Chris and I are both self-employed, and like many ranchers, farmers, construction workers, tradesmen, and small-town professionals, we do not have access to an employer-provided group health insurance plan. We buy our insurance, our family health insurance individually and directly. So I want to briefly explain some economics of that. Our current Blue Cross Blue Shield of Wyoming health insurance premium is $2,885.29 a month. And it's the bare bones bronze, blue, select, bronze, core, high deductible plan. Our family deductible in network is $12,000. Our out of network family deductible is $40,000. Our family maximum out of pocket in network is $14,300, and out of network is unlimited maximum out of pocket. So we pay a lot of money every month in premiums for a policy that is frankly not great. In comparison, the state of Wyoming group plan for 2024 provides several plan options with premiums for our family between $2,436 and $2,059 a month, with deductibles that range between $900 and $4,000. And there's actually a maximum out-of-pocket number, $8,000 at a maximum for out-of-network. It isn't unlimited. This is much, much better insurance coverage for less cost. So the opportunity this bill, if passed into law, would provide for our family is very meaningful. Why do you care about that? You care about that because my husband is a 21-year volunteer firefighter, putting his life on the line for the citizens of this state for 21 years and counting, a volunteer. The state, through its counties, does not have to pay a salary and benefits for him or the many other volunteer fire, EMS, and search and rescue personnel who serve the state. They serve the state with a passion unrivaled without salary benefiting their families. Their very existence is a huge cost savings to the state. If the state, through its counties, were required to fund an all-paid fire department, the cost would be crippling to the already strained budgets. We should embrace every opportunity that we have to increase recruitment and retention of volunteer fire, EMS, and SAR personnel, especially when, as is the case with this bill, such support doesn't cost the state anything. The volunteers pay the premiums. There's no appropriation associated with this bill. This bill does not ask for the state to pay for our health insurance premiums as if my husband were a state employee, but it gives him access to the state's superior health insurance plan at our cost. This bill allows my husband, and by extension our family, to join the group of state employees for health insurance purposes. I can think of nothing more appropriate for a dedicated volunteer firefighter. It will also be meaningful for retention. I, for one, will be even more supportive of the time my husband devotes to firefighting, training, and calls for service if our family has access to better health insurance by virtue of that service. It's no small thing. Please support this bill and the other bills before you that support recruitment and retention of volunteer firefighters, EMS, and SAR personnel. Not doing so could cost the state considerably in the future if volunteer recruitment and retention fails and you have to find funding for an all-paid fire, EMS, and SAR service. Thank you for your service and your time today.
Thank you very much for that testimony. Thank you for being with us today. Senator Dockstader.
Thank you. Chairman Munson, could you send me your, not your full letter, give me your talking points. You are in my district out in the far west. I like these points, and Mr. Chairman, I'd like to carry this bill. You are a prime example of what we're facing here, and I sense that you don't hear me.
I can barely hear you. It's very quiet for some reason. I've heard you just fine before I became a panelist.
2 inches away. Tech support.
We can hear.
If you can hear me.
I can. Yep.
Send me your points, okay?
Yes, sir.
Thanks.
Yes, sir.
Thank you very much. Actually, you ought to just send that to the whole committee. If you would just send that, do you know how to access the committee's emails, Robin?
I'm sure Chief Cooper will help me out.
Chief Cooper, what a guy. He will do that. He's shaking his head yes. Thank you very much again for testifying. Do we have any more questions, committee? Thank you for your service. Thank you for joining us today. Happy Valentine's Day. Thank you very much.
Thank you.
Okay. Anybody else wish to testify here in the room, virtually in the room? Seeing none, let's close public testimony. Bill moved by Senator Dockstader, second by Senator Barlow. Discussion, comments, amendments. I sense we're ready for the vote. Okay, let's do a vote.
This is a roll call vote on Senate File 8. Senator Barlow. Senator Bouchard. Senator Dockstader.
Aye.
Senator Hutchings. Chairman Baldwin. Mr. Chairman, we have 5 ayes.
That bill passes committee. Senator Dockstader, Laura managing that. I appreciate those volunteers. You guys are awesome. Okay, committee, we got, I believe, 4 bills in front of us Friday. So study up, yeah, it'll get worse. Thank you very much, everybody that came and joined us today. We appreciate it. This committee is done.